Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Guillermo Elizondo about the RSNA Introduction to Research for International Young Academics, or IRIYA program. Dr. Elizondo is the research director at the Autonomous University of Nuevo, León in Mexico, and chair of the RSNA Committee on International Radiology Education, which oversees the IRIYA program. Thank you, Dr. Elizondo, for joining me today.
Thank you, Jennifer, and thanks for the RSNA board to allow me to participate in this interview. Thank you.
Of course. What is the IRIYA program and why is it important?
Well, Jennifer, RSNA created the IRIYA program, 20 years ago in 2002. Basically, the focus to identify young international radiologists who wish to pursue a career in academic radiology. It is this program is aimed toward residents and fellows that are currently in radiology training programs from, I will say, both emerging and industrialized countries, or radiologists who are not more than 2 years out of the training. That is young radiologists is the name actually in our area, And applicants, one of the characteristics is that the applicants must be nominated for the radiology department chair or the training director who, I will say, ascertains that the candidate has shown a sincere interest in academic radiology during training and that they will benefit from this introductory course that the IRIYA offers to them. And this is a 4-day seminar held during the RSNA annual meeting, and the participants discover, I will say, the rewards of a career in academic radiology. They gain insight from very esteemed colleagues, radiologists from the RSNA members, and have the chance to meet future mentors. I think this is actually very, very important. And I know you have interviewed some participants, and we have participants from more than 65 countries.
So what can participants expect when they participate in the program at the annual meeting?
Well, first is that we have to say that just 15 candidates are chosen each year to participate in this 4-day program. That the program basically focuses on academic radiology and is held, as I told you, during the RSNA annual meeting. The participants first, they receive the travel stipend, and they share hotel or room accommodation, which, by the way, is something I have found very interesting for them, very enrichment for them, because they make friendship for life. I know from some students or some previous applicants or candidates that were in previous years from Mexico or Latin America, and they told me that the friends they did, especially on the room, is that lasts forever. And well, in particular in the course, the topics that are usually discussed during this session, during this course, I will say, is there are several. And first is how to design and plan a clinical research protocol or study. They also review some basics of statistical notions, something which is very important. They review all the research ethics behind how to conduct ethically all these research studies. And for making a study, for knowing what is happening and what it needs to have answers, it is very important. And they have also, some sessions about evidence-based medicine evaluation of literature, because this is very important. And then they also have or participates in workshops in how to prepare their manuscript. As a matter of fact, they are asked to bring to the meeting for this course the protocol, the study they are working in right now. They have to submit that, And then they interact each other and with the mentors, with the professors, in order to have suggestions or how to improve this, the preparation of the manuscript. And well, finally, this is like they are shown about the academic pathways with emphasis, I will say, in the international challenges and opportunities that they will have for the future, and with the help of the RSNA. Obviously, there is more information about all the characteristics of the course at the RSNA webpage.
So IRIYA accepts applicants from countries outside of the US and Canada.
Mm-hmm.
How does the engagement of global voices benefit the radiology community?
Well, excellent. Well, I tell you, during these past 20 years, 314 radiologists from 66 countries have participated in the program. And I will say that not all of them, but a significant number of them have continued on the academic path. And as a matter of fact, they are distinguished in their respective countries, and in both, I will say, teaching and research. And as a matter of fact, many of them are participating now in RSNA, either in refresher courses or in committees like ours. So I also have to say that it's very important from the RSNA point of view to promote diversity and inclusion in these radiology fields that, I mean, reflects that it serves to everybody. I mean, all humanity is served by radiology, so we have to have inclusion and diversity in that. And IRIYA has a way also to make, I will say, connections that will or could lead to new opportunities, and especially important for us is for women and for minority groups.
What do you see in the future for academic radiology?
Well, this is a very difficult question with many answers probably, but if I have to, I have to see the roads of academic radiology, I will, Jennifer, probably say two main paths, two main roads. One is about the challenge that I see and how to teach the teachers to fill the gap. And let me explain it. When I, for example, when I enter my residency in radiology, my residency program, and I look at the journal radiology journal index, well, I could see the titles, I could see the papers, and I can easily ask my teachers, my professors, my mentors, if to show me, to explain me what a colon cancer, gastric cancer, or radiology, science of chest, etc. And for them was very easy, because basically was, I will say, the same kind of information, more refined, but the same kind of information that they learn. But nowadays, this has become so specialized, so technical, I will say, so advanced, that many times we, I mean, now teachers, because now I am the older, I have young people, we don't even, I mean, we have to be humble. I mean, we don't even understand the title of the article, not to say the content. I mean, if you think about artificial intelligence, tensor imaging, metabolic findings on PET-CT, cardiac protocols, well, as a matter of fact, RSNA, when I was a resident, had two main journals, radiology and radiographics. Now we have 5 with cardiothoracic imaging, artificial intelligence, oncology. So this is basically impossible for one person to know everything that is happening. But the other part, I mean, the other road that I see is that, I mean, for me, this is like the most challenging, I would say, interesting and excitement time to be a radiologist, because we have the opportunity as a radiologist to be, I mean, I foresee a radiologist in this, I mean, screens, and to become the data scientist, to be the ones who can, I will say, orchestrate patient care. I mean, for me, this is just this is just fascinating because we are the ones, for example, that, I mean, who else in medicine, I would say, can handle information technology, all these protocols, artificial intelligence, electronic medical records, radiomics. And I think that we academic radiologists, as you ask, are the ones in charge to prepare the new generation of radiologists. And in this context, I think the RSNA is strategically situated to help academic radiologists from around the world to accomplish this mission that our field has. And we have to, I mean, we have to think that every country, even every city in the country, and probably even every residency program has to customize their needs and the strategic solutions that they will need for the particular population. But I am sure the RSNA, with committees like the CIRE, in which I'm participating, and programs like IRIYA will be the reference to help to succeed in this future challenge.
Definitely. I think RSNA-led education initiatives are definitely helping to meet the growing demands of global radiologists. Would you agree with that?
Well, yeah. I mean, during the years, I have been participating in RSNA for the last almost 40 years, 39 years, I believe. And RSNA has done many adjustments, many innovations for these demands that you ask. I tell you, concerning the International Radiology Education, the CIRE, well, all the programs that it has developed have grown, I would say, in scope to encompass the needs of radiologists from around the globe. These needs obviously have evolved, and so much the way in which we have to address them and to teach them. And for example, even before pandemics, but during pandemics, I'm sure after, hopefully this is going to end. I mean, but in the future, we all have seen more virtual options the RSNA has to offer. We have now, as society, regional events, the spotlight courses, or the opportunities for low-income countries like global learning centers. These programs are part of the CIRE, but this is not, in matter of the time, I'm not going to go deep on that. But there are many other aspects that RSNA is working in the global sense. And the other important part that I acknowledge is that the RSNA allows regional committees to help them to take decisions in where to go, what to focus. I mean, this kind of international participation that RSNA allows is, I think this is very important. And well, the current status of globalization provide us, I mean, as part of the RSNA committees, with more technological tools. And these are to embrace and we have to incorporate them into our methods of either of teaching or learning. Okay, and I think this is very important. In a few words, Jennifer, there is no doubt that programs like IRIYA have been very successful, and the experience acquired during these 25 years CIRE has been working in the RSNA, the 20 years from IRIYA, well, will allow us to dream, I would say, of more futuristic goals.
Well, great. Thank you so much for your time today. To learn more about the IRIYA program, visit rsna.org/IRIYA. And for more radiology news, visit rsna.org/news.